He's a very nice kitty in that everything is dissected out very nice and cleanly, even though it's a small kitty. So if we start at the base of the heart here, we have two large vessels, one here, coming out of the arch of the aorta. The one on the left is the left subclavian artery, so you have to tell me left on that, because the one on the right is not the right subclavian artery. This would be the brachiocephalic artery, so there's only one of those. Oh, this kitty's just lovely. My goodness. This is the best kitty I've seen in terms of being able to see very clearly that this brachiocephalic artery branches 3 times. The first branch here is the right subclavian artery, and these other 2 branches are the common carotid arteries, which you can easily follow up into the thoracic cavity and see that they are the common carotids. But this is one of the few kitties where the vena cava is not covering up the 3 branches so that you can't see them clearly, so that's very nice. If we follow this left subclavian, and if we followed the right subclavian, it would do the same thing. It's just easier to follow the left. If we follow this left subclavian artery out of the body, out of the thorax, it does very briefly become the axillary artery. I will not ask you that because it's so subjective where it's leaving the body. But I do expect you to know that once it is out here in the forelimb, and you can see it right there, that it is the brachial artery. And there is one branch that you have to know coming off of the brachial artery, and that would be this branch right down here that I've got the probe under, and you can see that it's diving down into the area underneath the scapula, and it's called the subscapular artery. Questions on those arteries? Let's do the veins. Okay, we start out, you just ignore if you see that little common trunk of the mammary vein. I will not ask you that. So we're going to start with the anterior or cranial vena cava. It's coming back into the right atrium. As soon as it branches, these 2 branches are called the brachiocephalic veins. Okay, so these are all veins. Did I say artery? Veins. And this brachiocephalic vein will again follow it on the left here. It's going to branch 3 times. The first branch, actually on this kitty, is very nice. You can see this first branch here that's not terribly long before it dives down into the tissues, and that is the common trunk of the costocervical and vertebral trunk vein. And yes, that has shown up on my practicals. The second branch, this kitty does have a break here, would have attached right here, and it would have very briefly been a subclavian vein, which I never asked, but I do expect you to know that once it goes out into the forelimb, this would be your brachial vein running right alongside your brachial artery. It will also have a branch coming off of it that will go down to that same area under the scapula. So here is that subscapular artery, and you can see right next to it going down to the same area is the subscapular vein coming off of the brachial vein. And if we follow it down a little bit further, this is not the best example, but you can see that we have the cephalic vein going down the front part of the forelimb here, the anterior surface of the forelimb, and there is, this one's broken, but the vein that crosses over between the cephalic and the brachial veins would be the median cubital vein. So there may be another kitty where you can see that better, but that can show up on the practical. Okay, so people can go over there and look at that. And there were some very good ones in the Tuesday lab, so I don't know whose kitties I'll be using, but it's fair game. This third branch off the brachiocephalic vein is the external jugular vein. Make sure you say external because there is an internal jugular vein, so you have to identify it as external. It comes up here and it branches to either side of the masseter muscle. The posterior branch is called the posterior facial vein, the anterior branch, the anterior facial vein, and this one isn't too great here, but this branch that crosses over between the two external jugular veins is your transverse jugular vein. And it's not great on this kitty, but it's certainly good on others, so it would be fair game for the practical. Questions on the veins? Your aorta. You know, it's just like what we do with the bones. Sometimes people remembered all those little structures on the bones and they couldn't remember what the big bone was. So make sure you know the large arteries and veins and not just the little branches. So that's the aorta. If we go up and start with the most anterior area, these are much smaller than they will be in a larger kitty, so I strongly recommend that you look at a bigger kitty too. Okay, right here, this one here that's going up to the stomach region would be the celiac artery. The one just posterior to that that's going to the mesentery of the small intestine would be the cranial mesenteric artery. And then if we jump down here to the one that's going to the mesentery of the colon, that would be your caudal mesenteric artery. So remember, they are not paired. Celiac, cranial mesenteric, and caudal mesenteric arteries are not paired. Now this one coming off here and going up to the kidney would be the renal artery. Don't tell me kidney artery, it's the renal artery. But no one should get that wrong because it's going to the kidney. The kidney is your landmark. If you follow down here, after the caudal mesenteric artery, you see on either side, coming off kind of at a right angle, these little arteries that are the deep ileal circumflex arteries. And right next to them will be the deep ileal circumflex veins. Go down to where the aorta ends, put that tissue out of the way, right there, and you'll see the V within the V, and the outer V will be your external iliac arteries, the inner V will be the internal iliac arteries. Going back to the veins, remember we have fewer veins to look at because the hepatic portal system in these kitties has not been injected with latex. So here we have well, first of all, the great big vessel would be your posterior or caudal vena cava. The vein going up into the kidney would be the renal vein. Down here, I already told you, these are the deep ileal circumflex veins going off with the arteries on either side. And then your vena cava, it's a little hard to see because it tends to be under the aorta, is going to end right there, and we're going to have a branch going there. I think on this kitty you can see nicely the two branches. One branch is here, the other branch is there. Remember that these are not external iliac veins, these are common iliac veins. Remember, there's no common iliac artery, but this will be the common iliac vein. And if we follow that common iliac vein out to here, again, this is a lovely kitty. You can actually see very clearly where it divides, and this is your internal iliac vein, and this is your external iliac vein. But it's not branching till out here. This would be the common iliac vein. Once it's out of the body, then it becomes the femoral vein, and your external iliac artery becomes the femoral artery. Did I leave anything out? Anybody? I think I got them all. Questions? Anything anyone wants?